Hello. It's been a while, but I'm back. So this video is for people who work in the health sector. So it's packed, it's full of opportunities for leadership, for attending conferences, for, master's programs in UK and all of that. It's packed. So please stay with me. But before we get into it, please do me a favor. For us to grow this channel together, please subscribe. There's a purple button here. If you click on it, it will show you the subscribe button. You just click on it. And after watching this video, if you like what you have watched, please like this video because that will help YouTube algorithm to share the video as widely as possible. So without wasting much of your time, let's get into it. Okay. So the first opportunity we are looking at is scholarships to attend AIDS 2024 conference, which will be in between 22nd and 26th of July. So it says scholarships are open. Let's take out this. Okay. Scholarships are now open. If you're at least 18 years old on 20th of July 2024 and working, volunteering, or studying in the area of HIV, you are welcome to apply for a scholarship for AIDS 2024. This is the 25th International AIDS Conference, which takes place in Munich, Germany, and virtually from 22nd to 26th of July. The scholarship also supports attendance of the AIDS 2024 pre-conferences, which take place 20 and 21st of July in the conference venue. So before we even click on apply, there's more information. The following candidates will be given priority: abstract presenters, workshop facilitators, and co-facilitators, global village organizers, co-organizers, whose submissions have been selected for the conference, but also applicants from low income and lower middle income countries, applicants who are part of key populations and people with living HIV, young people. This is so important. Representation is very important. If you are someone living with HIV, this is an opportunity as well to attend the conference. Young people and junior investigators below the age of 35, applicants who did not previously receive a scholarship for an international AIDS conference. Please note that we are also offering scholarship for a limited number of media representatives. So if you are a journalist and things like that, you can click here and check that. But we're not going into that, otherwise it will take us the whole day looking at everything else. So here we go. This is how you apply. If you don't have an account, this is where to start from. It says create or sign in. So if you don't have an account, you will follow create. If you already have an account, because maybe you tried to apply before, then you just follow sign in. So if you already have an account, this is where you put your details. If you don't, and then click sign in. Don't have an account, you come here, create an account. Okay, you put in your email address. You think of a password that you can use. It doesn't have to be the same as your email address. We always use different passwords for different things. Okay, and then your details. Yeah, just make sure everything that has an asterisk, this red star here, make sure you put in. Are you living with HIV? Because I'm sort of emphasizing on this one as well, because we know representation is everything. You cannot have conferences without the people that you are talking about. So yeah, but as we saw at the beginning, it's for different things. Okay, complete, create account, and then make sure you agree on here to the data privacy. You can read the data privacy policy, but there's no need. And once you create account, then you can log in to complete the application form. We are moving on. Number 2. This is called GSK scholarships for future health leaders. 3 scholarships are offered to support. I expected more than 3, but hey ho, half loaf is better than none. 3 scholarships are offered to support the training and development of the next generation of leaders in global health and strengthen the capacity of health systems and health-related research in Africa. These are highly competitive, so up your game, okay? These highly competitive scholarships are available to applicants intending to study on a 1-year full-time London-based face-to-face Master of Science program at the London School of Hygiene and Tropical Medicine, LSHTM. Award details. 3 scholarships are available for 2024-2025. This is what we also need to get clear about. So we are not applying because we're in 2023 now, so it's not about 2023. The academic year starts around September 2024. So when you're applying for admission with a university, make sure you're applying for the September intake, because you cannot apply for any other intake before you secure your scholarship. So eligibility criteria. These things we're just repeating in case there's someone who doesn't know or can benefit from such information. But it doesn't mean that this information, what I'm saying, applies to everyone, because we are all at different levels of this journey of applying for scholarships. So eligibility for funding. So just ignore things that don't apply to you and just focus on things that apply to you, okay? Eligibility for funding. To be eligible for these scholarships, applicants must be nationals or residents of countries in sub-Saharan Africa, right? And you're intending to return to sub-Saharan Africa on completion of your Master of Science year at London School of Hygiene and Tropical Medicine. This is you cannot guarantee. Sometimes it depends on the situation in your country, what is happening there. So you cannot guarantee that after completion, I'll automatically return. Many people do return, but if there is something that is stopping you from returning, that also is a possibility. Okay. That said, let's finish on the eligibility. If you know, you know. Confirm that they would not otherwise be able to pay for the proposed program of study by submitting scholarship application form. How do you confirm that you would not be otherwise be able? Some people show their monthly salary. This is so much I get. Some people show their bank statements. It's empty. 0, 0, 0, even minus. Every month there's nothing. But sometimes it's a matter of like ticking a box. I haven't seen the application form, so ticking a box, I can't afford this. That's why I'm applying for scholarship. And also hold an offer. So this offer of admission, this is so crucial. You cannot apply for this scholarship before you get offer of a place. So keep this website for yourself, but you start with pick a Master of Science first by clicking here where I'm rotating the cursor, and we'll get to look at the courses in a minute. But also keep in mind the deadline, 4th of March, for the scholarship. But for the admission with the university, for them to know that actually, yes, this guy or this lady is eligible for our scholarship, is eligible for our courses, you need to apply and be offered admission. Okay, so this is where you will go. But let's look at the scholarship thing first. So once you have applied to the university, which is step one, we'll look at, okay, let's just look at the courses here. Representation is everything. Where's a Black woman here? All right. Okay, but yeah, it does show that anyone can get this scholarship, so it's not just for one group of people. Yeah, okay. I would, because I'm a woman, so definitely I'm gonna talk about Black women, definitely. As I said it before, representation is everything. Okay, enough of nagging. Right. Our master's degrees can be tailored individually to your personal learning, yada, yada, yada. So they have a list of programs here. Which one are you drawn to most? Based on your experiences. And they will tell you, once you click on anyone that you are interested in, then you go through the process. This one also has a distance learning, but for the scholarship, they've said only face-to-face. So you would be applying on face-to-face. So you read about how this Master of Public Health is structured, entry requirements, and how to apply, and you follow and apply for admission. Okay, so let's get back to scholarship. Is the one more? Okay. In your application to study, you should select scholarships you are applying for in the funding detail. So now you know, this is why most of the time people ask, oh, what is that? Is it the scholarship or the admission? You start by identifying a scholarship first, just knowing that there is a scholarship that I am eligible to apply for. That should be the first thing. So where does that scholarship leads us to? Like in this case, this GSK scholarships, it's leading us to this particular university. So then that's how you know to say, okay, because this is the scholarship that I have identified, I'll apply to the London School of Tropical Medicine and stuff like that. Okay? London School of Hygiene and Tropical Medicine. So what stands, in my opinion, it's you identifying the scholarships that are speaking to you. Once you identify, that doesn't mean applying, but identifying. Like now we have identified GSK for people who want to do a master's degree in these health-related programs, face-to-face. Then you know that the university you can go to is London School of Hygiene and Tropical Medicine. If you start with the a course because, okay, I like a Master of Public Health at the University of Malawi College of Medicine, and then you apply to College of Medicine first, and they start for looking for scholarship. Sometimes it does work, sometimes. But it's like, it's the hard work, because having admission, now you have a feeling to say, oh, I'm going to uni. But you didn't identify the money. You can't just go to College of Medicine without identifying where you will get the money. So yeah, identify the scholarships first that fund these courses at College of Medicine. Then you decide to go to to apply to College of Medicine. That's my kind of thinking. I think it lessens, it just reduces the stress, the anxiety, and all of that, because having admission, it's exciting on its own. It is an achievement. But if you don't have a plan in place for it, trust me, it can be it can be a painful experience as well. Right. Okay. So yeah, so the steps are clear. You attach application form. So make sure, I'm not opening this because otherwise then we'll start going into question by question and all of this, all of that. But it also says important information. It's always good to read the website in its totality. so that you understand it inside out, because that's what gives us insight of what we can include in personal statements, in whatever materials they are asking for, because you understand, you are addressing why this scholarship has been put in place in the first place. And once you are speaking to the main reason why this scholarship was put in place, why this scholarship came about, if you address that, if you are the one they are looking for, I think that's also where the secret lies. Okay, so understand what this scholarship is about and address that. We are moving on. Too much of talking. Here we go. This one is okay. Yeah, GSK again, but a different opportunity. We are changing the trajectory of high-burden diseases in low-income countries with a focus on infectious diseases. So what are they saying? Infectious diseases such as malaria, TB, and enteric diseases are among the leading causes of death globally, killing almost 9 million people each year. These diseases, which are often preventable and treatable, disproportionately affect sub-Saharan Africa populations, and when left untreated, result in poor health outcomes and morbidity, higher mortality in co-infections with other infectious diseases, stigma-related mental disorders, and exacerbated social and health inequalities. Research is critical for the development and implementation of effective measures to meet the global health challenges of eliminating infectious diseases. Having previously funded 20 projects through the Africa NCD, Non-Communicable Diseases Open Lab, until our last call for proposals in 2022, we are now calling for research proposals focused on funding high-quality infectious disease research that has the potential to deliver significant health impact and develop future research leaders with up to £100,000 available per award. God, this is a lot of money, especially that the research will be done in sub-Saharan Africa. So £100,000 is a lot of money. Along with the award, we offer mentoring, scientific and technical support where you conduct your innovative research project. And the deadline is 29 January 2024. So what's included in the award? Let's see. You go on this drop-down arrow here and read. Up to 100,000 available for 36 months. The award will offer funding to cover costs of an appropriate research project, including cost of equipment, field work, data collection. So you can pay your data collectors and all of that. Is it only data collectors or even the respondents? I think it has to be both, because there is yeah, people are putting in their time and they are giving us the information and they are being allowed to be studied. I think there has to be a way of appreciating that offering and kindness and gesture to be fair. So they can only be rewarded if it's put in the proposal, if it's embedded in the proposals. Because everyone has needs, just like ourselves. We want to do the research because we know we're going to be paid, So why can't the same also extend to other people that we are working with? It just, I think, it just shows our, our truest self, our values. Because if we want, okay, let me not get into that too much, but I think if you know, that's all I can say. So yeah, enough of extraction. I know research benefits the community, but the community needs also to benefit in terms of yeah, things like money, if there is money. Yeah, so conditions, read for the conditions for applicants. We're now opening that. Please go to the JSK supported status website here. You need to register to access concept application. So this is the link that you're gonna use, but I'm not going there. Otherwise we'll take the whole day looking at everything. So here's the information. If you want funding to do your research, this is the link. Okay. Right. We're moving on. This is the final one by Science for Africa and a call for applications, epidemic science leadership, and innovation networks. Okay, let's see. Key dates, November 2023 to January preliminary applications. Which date in January? So the call opened on 16th of November. Deadline for preliminary is 31st of January. You still have a month and a half if you see it around the time that the video is released, which will be 16th of December, 2023. So, okay. We don't need the background. I don't need to read the background because you will read it. So let's look at the eligibility, who they are looking for. Hold an academic or research post to have a salary or guarantee of a salary for the duration of the award period, or yada, yada, yada. And then the thematic areas, they're looking at vaccinology, virology, clinical research and clinical trials on epidemic and pandemic-prone infections, epidemic and pandemic public health policy research, climate change, biodiversity and pandemic prevention, advanced data assembly and analytics for threat assessments and mitigation, social and behavioral sciences, and the core guidelines and the budget. How much budget? Oh, come on, budget. Applicants should prepare a core budget for up to 4 million US dollars over 5 to 6 years plus specific additional elements as detailed in the core guidelines, yada, yada, yada. Okay. So this is it. And so they had a webinar on in December, which they have recorded it, but they also have another webinar on, December 6th, they already had that. On January 17, 2024, they will have another webinar. Come back to this website for information about how you can join if you have questions and all of that. Applications should be submitted via SFA Foundation Management System, and the link is here. Login, yada, yada, yada. Where they recorded the webinar, I'll also put this link to their YouTube channel so that you can watch. It's 56 minutes long, the Q&A session that they've already had. Or you can attend the next one. Okay, so this is it from me, guys. I hope you enjoyed it. And once again, please, if you loved this video, make sure you subscribe, click on the purple button just here where my hand is. And also, please do watch these videos and like this video. Press like just below this video. There's a like button. Please like the video. Yeah. Hope to see you soon. Nasekera nana, era kunkune, era babuya, era babuta, era pakwiza, vayeya, era kadende, era kampangwe nasekera.